Hi folks, my name is Chris Wilson. I'm a physical therapist and I want to talk to you today about what to expect at physical therapy. This is a big question that comes up a lot, and it's really important for you as a patient or a prospective patient to understand what to expect and what to share. Too often I run across patients who think that I'm going to tell them exactly what they need to do, that I'm going to know what's happening in their body. What I like to tell people is that every single person I've ever seen in my career, they have had their body for far longer than I have been exposed to it. You as a patient are going to know your body so much better than me. I'm going to ask questions. I'm going to help dive into it and guide you in this process, but I'm there more to be a coach, an educator, and be a partner with you. And that's what you should expect of your therapist. We're not here to dictate to you. We're there to be guides and mentors and resources to help you get to wherever it is you want to go. Every person has different goals, different ambitions, different things they're trying to get back to. Some people may be trying to get back to work, sitting at a desk and being able to tolerate that without their back or neck hurting. Others people may be trying to get back to high levels of competition. It all varies. Some people respond great to manual therapy. Some people need an exercise-based approach. Some people need dry needling. Some people need other services that are out there. The list goes on and on. Never mind the fact that there are orthopedic conditions, there are neuromuscular conditions like strokes, there are vestibular conditions like dizziness and balance disorders. There are so many different things out there that we need your help getting to that, and you should trust us to be a mentor, to work with you, and not to dictate or preach to you. I like to think of it as the 4 big E's. We want to be able to engage with you. We want to educate you. We want to empower you. And then a lot of times we want you to do a little bit of exercise. Quite frankly, that is, you'll hear it said, exercise is medicine. It is so true. It impacts almost every aspect of our life. It is so simple to do. It takes no equipment at all, but that doesn't mean it's easy. Simple is not always easy. And so again, we're there to be a guide. We want to understand what is your pain. We want to understand what the pain is to you. That 0 to 10 scale, that's a starting point, right? What does that mean to you? It's nobody else's scale, it's your scale. Let's dive into that. How much pain can you tolerate? What is an appropriate amount of motion that you can do? That's critically important. And then we've got to figure out what is the activity, the exercises, the interventions that are meaningful to you and allow you to progress. If you're going to therapy and you're doing the same stretches day in and day out, it's not worth it. You can do that on your own. If you're going to therapy and you're not seeing a change within a couple weeks of your pain, your range of motion, your strength, your balance, or something objective and meaningful to you, then you need to have a conversation with your therapist and let them know, hey, I'm not getting out of this what I expect. Hey, I'm not being challenged enough. Hey, I need help because I don't see how this is going to help me because I'm still in pain. I'm not stronger. I don't move better. Nothing seems to be helping. Don't assume that I know that. Even if I should, we still want to hear it from you, and that allows us to re-engage and say, okay, we tried the primary plan. We followed evidence-based practice. It's not working for you. Let's take a little detour and see if that helps. And you'd be surprised how often that is successful. You'd also be surprised how often people sit back and do the same thing for 8, 10, 12 visits without results thinking, well, that's the therapist. They know, and it's either working for me or it's not. And then if you don't talk to the therapist or the therapy team and you have a bad experience, the thought process is, therapy just doesn't work. And what I would challenge you is that you would never say doctoring doesn't work. If you had a negative experience or not an optimal experience with your doctor, you're going to find somebody else to go to. And that happens in therapy too. It can be the wrong personality type, it can be the wrong background or experience, the wrong setting, the wrong environment. But there are so many opportunities to come across great physical therapists that will help you. Don't give up on it just because it didn't work once. Don't give up on it because it didn't work in your knee. That means it won't work in your shoulder. So many opportunities. Exercise is medicine. Movement is medicine. Physical therapists are musculoskeletal experts, but they are still there to be coaches and mentors and partners with you. And at the end of the day, it is your body, your health. We want you active. We want you engaged. We want to partner with you. And that's what you should expect from your physical therapist. Thank you so much.